Welcome to Autism Parenting in Nigeria and the Autism Parenting in Nigeria podcast, now renamed Autism Mom Strong Podcast. I am your host, Dr. Chisom Pascaline. Today, we will be talking about autism spectrum disorder and how to know that your child has autism. Here, we'll talk about the signs by age and the next steps. So, what is autism spectrum disorder? It is a neurodevelopmental difference that is characterized by changes in social communication and interaction, by restricted or repetitive patterns of behavior, interest or sensory responses. It has a wide variability. That's why the children or the individuals are being said to be on a spectrum, because one can have a mild adaptation, a moderate influence, or a severe case of autism. Early identification and early supports will improve outcomes like communication, participation, and overall family well-being. Now, what are the signs by stages? A few signs can be picked up at infancy. Here I'm referring to ages from 6 to 12 months. 1. A limited eye contact or social smile. Reduced interest in faces. Children at this stage usually like to look at faces. So here they will have a reduced interest and have a reduced social engagement. Reduced response to name by age 12 months. Reduced babbling or few communication gestures like pointing, like waving, giving high fives, and all of that. For toddlers, here I'm referring to from 1 year and that's 12 to 36 months, 12 months to 36 months. Here you have more profound language and gesture delays. You have very few words by 16 months or two-word phrases by 24 months. So ideally, children up to 2 years are supposed to have up to two-word phrases. Those up to 1 year have one word, single word, words or phrases, if you can call it that, and also respond to one-step assignments or errands, while those up to 2 years can do a two-step errand or assignment. But here in this case, it's usually reduced. They might have limited pointing to share. So you don't get the child sharing interests, pointing, telling you this or that, pointing you to specific things. They also have reduced response to names. They have repetitive movements and marked sensory, either hyperactivity or hyperreactivity. For the preschoolers and the early school stage, that's from 3 years to 7 years, here you have reduced peer play. They find it difficult to take turns and are not flexible with pretend plays. They understand things literally and have challenges with reciprocating conversations. They also have restricted interests that is unusually intense and specific. They have rigid routines. They are anxious with change. They have sensory differences. For the older children and teens, here I'm talking about 8 to 18 years of age. They have issues with friendship, humor, and group dynamics. They may prefer predictable routines and special interests. They have increased anxiety and they overload in noisy multi-step environments. They may have strengths in certain areas like memory for facts, honesty, and deep expertise in different interests. For adults, they have a lifelong history of social communication differences and restricted or repetitive behaviors, especially in women or gender diverse people. where they undergo or they have the masking traits or camouflage. They might just make up for it with other activities. Now, how can you tell if a child is slightly autistic? Actually, slightly autistic isn't a clinical term. Clinicians describe support needs, level 1, level 2, and level 3 across the core domains. With level 1 being termed the mildly autistic individual that might have some degree of independence requiring just little assistance. Level 2 requiring moderate assistance, while level 3 will require significant assistance throughout life. Now, what are the 5 common signs of autism? This will include communication or gesture delays, reduced response to name or limited eye contact, limited joint attention or pointing. They have repetitive movements or restricted interests and unusual sensory responses. Yes. So, how can one get an autism diagnosis? Step-by-step process. First, you have to talk, if we're talking about a child, you talk to a pediatrician or a general practitioner for an adult or even still a child. So you share specific examples or videos if you have or if you're a parent. Then, of course, the primary care is screening. There are standardized tools like the MChat and all to be able to know. There are also comprehensive assessments that will involve the developmental history and observation maps for DSM 5TR and the adult tools and so many other tools. The person can also undergo a hearing and medical check to rule out other contributors like a hearing loss. Then, after a confirmed diagnosis, you discuss genetic testing. Yeah, so in the first year is normally if there is any chromosomal microarray, and where appropriate, you can check for Fragile X syndrome and other targeted tests. And then, of course, you begin support the right way, usually therapy access. What kind of therapy can this child need? From the assessment, one may then know the kind of therapy the child will require or the individual may require. Will it be speech therapy? Will it be occupational therapy or behavioral therapy? This will be broken down following the assessment. So, what can you do if your child is 2 and you're worried? So you can start parent-mediated strategies if you can't get an assessment right away. Start with what you have and start helping out as little as you can, because it's been proven that early intervention is key to a lifelong best outcome. So what can you do now? Try and get support. Subscribe to our newsletter on autism parenting in Nigeria. Follow us on Instagram and Facebook and across all social media platforms. Until next week, I am still your host, Dr. Chisom Pascaline.